Hi, everybody. Welcome to my YouTube session of Mediation and Beyond. And today I'm really fortunate to have Dr. Veena, actually it's Veena Verma-Dzik. She works at Insight Counseling here in Connecticut. She's a board certified naturopathic physician and a certified medical acupuncturist who is highly experienced in treating acute and chronic health conditions. Dr. Verma received her doctorate from the University of Bridgeport. They have a great College of Naturopathic Medicine, and she's received further training and certification in facial rejuvenation, acupuncture. I'm going to have to ask her what this is, MTHFR, and Lyme disease.
Yeah.
Some of her specialties include women's health, ADD, ADHD, GI conditions, Lyme disease, co-infections, mood imbalances, allergies, fatigue, hormonal imbalances, and so much more. Each patient she sees receives personalized, individualized care involving research-based treatments and therapies from her own clinical experience and success. And the therapies she prescribes include herbal medicines, nutritional therapeutics, homeopathic medicine, low-dose immunotherapy, and acupuncture. So when it comes to diagnosing, Dr. Verma uses in-depth functional laboratory testing and analysis, and she takes the time to sit and listen to her patients, and therein lies a lot of the success. So her success lies not just in identifying and treating the physiological causes of each individual's condition, but also really spending time to get to know her patients, educating them on how to make effective lifestyle changes, providing the support each person needs. Her focus is to truly help her patients achieve physical and mental health and prevent illness. She has extensive experience with Lyme disease and actually living in the East here. I'm sure that's, you have a number of patients with that. And she's able to integrate those therapies with conventional medicine. So Dr. Veena, thanks for coming on today. I really appreciate you being here. It's really nice to see you and to meet you.
Nice to see you. Thank you for having me.
Oh, absolutely. So how I came across you was I was reading an article in a magazine. And it's this article for anybody who'd like to see it. I believe it's in, Natural Nutmeg. And it's called Supporting Your Immune System During a Pandemic. It was a really concise, clear, succinct, great article. And I really got a lot out of it. And that's why I thought, if I got a lot out of it, there's going to be a lot of other people who will get some kind of nugget out of this. And what I thought bringing you on now was really appropriate, because as we're kind of hunkering back down into the pandemic because the flu season's upon us and coming, I thought your article about the immune system during the pandemic was just like spot on. And so I wanted to speak, or have you speak and learn from you about some of the things that we could be doing to help ourselves stay healthy and aware. So can you speak to some of the things that you think will help us going forward?
Yeah, there are a lot of things that we can do for our health. I mean, this is not just during the pandemic, but it's even minus the pandemic on a day-to-day situation. First of all, obviously diet is extremely important. And I don't think what people realize is that when people are under stress and have illnesses, whether it's acute or chronic, there are nutrients that our body stores within our cells that our body depends on in order to fight off infection. And after being sick for a period of time, those nutrients become depleted. And this here lies an issue for when people are constantly becoming ill, because those nutrients essentially, because they get depleted over time, they're not widely and readily available for our bodies to use, for our immune system in particular, in order to fight off infections. So most common nutrient deficiencies are magnesium, zinc, selenium, some of our B vitamins like B6, B12, and folate, vitamin C, of course. Vitamin D, of course, is another one. As you know, vitamin D, there are so many studies out on vitamin D. There are receptors on the white blood cells that allow the immune system to respond. When anything enters the body, the receptor turns on and vitamin D comes into the cell and gets them working. So vitamin D is really, really important. Another thing that vitamin D actually helps do is it does have some it induces certain proteins that have antimicrobial benefits, just to put it simply. And these can actually help decrease the rate of viral replication. So that's another vitamin that's essential. So when it comes to our nutrient status, consuming a diet that's extremely healthy, high in nutrients, high in polyphenols, like antioxidants, is really important.
Do you ever, I mean, science has never been my thing, although I come from a medical family, sciences. But do you bank, like, so if I took vitamin D, I'm low in vitamin D. I just got my blood work, I'm low in vitamin D, so now I'm taking my vitamin D supplements. But do you ever, if you take your supplements on the daily, so when you get sick, is it kind of like filling the bank so that you're, or do they get used every day so you just keep using them? Or do you ever bank them in your system?
So you do actually store it. I mean, you obviously that's where the supplements come into play. Obviously, taking a good quality supplement. So you do end up storing these nutrients. So then, when the time does come where you do get sick, which we all do get sick once in a while, our body's able to fight it off much more quickly, effectively, and it decreases our downtime, and we're able to bounce back much more quickly.
And when so you just mentioned taking a quality supplement. So the market is obviously filled with all different brands. And so how do you know what's a good brand? You know, is it a vegan brand? It is not a vegan brand. Is it pill form, capsule? Like, how do you know?
Yeah, so there are a lot of different companies. I mean, so many companies, and it can be very overwhelming for people when they're shopping for good quality supplements. I typically look for ones that are CGMP verified. I make sure they go through quality testing, you know, making sure that they're free of heavy metals, pesticides, and other toxins. There are definitely brands that I like better than others, just based on both personal and clinical experience. At times, I mean, you can have two different vitamin C brands, but one will just work better than the other.
Okay.
So that's how I generally pick my supplements, but then ultimately it's really based on my experience.
Okay, from your experience working with your clients, like to see
Yeah.
what kind of, so you have your own kind of study group, so to speak, right?
Yeah. Well, I have my patients, and then I also have myself and my other guinea pigs at home.
Yeah. That's a good way to do that.
I'm like, okay, this isn't working for you. Let's try this one. And yeah.
See what works and see what works best. So obviously vitamin D, and then I was reading in the article, and I'm going to not say this right, I'm sure it's quercetin.
Quercetin, yes.
Oh, okay. And so you have in here that it has coronavirus effects. And
Yeah.
it's in the International Journal of Antimicrobial Agents. And so obviously there's probably some validity behind that, but I've never even heard of it. What is it? Where do you find it? Where do you get it?
So quercetin is actually a polyphenol, and most people take quercetin during allergy season. And by coronavirus, just so you know, mostly the efficacy of quercetin with coronavirus is not this COVID-19, but it's the other coronavirus.
Right.
Way there's some, you know, clarifying that. But quercetin also does have antiviral properties, or it helps modulate what's called unfolded protein response. And some viruses actually use this unfolded protein response to help complete their viral life cycle. So quercetin comes in, and that's where it had some of that antiviral activity by helping modulate that.
Gotcha. So so this is my ignorance here. Can you find that in food? Is that in a pill form? Like, where do you find quercetin?
So quercetin, I usually actually give it in supplement form. So full disclosure, my family and I, we're on a whole protocol, especially this time of year, and even it's amped up in light of what's going on. So quercetin is actually one of the supplements. Even my kids they're taking that right now. So I have them on a combination of that, zinc, and then some other vitamins, vitamin D, of course, vitamin C. So that is really essential, actually, for flu season's around the corner. It's not
Right.
far, so
Right.
it's a good time to start having these in our medicine cabinet.
So that comes in a supplement form. And you mentioned zinc, and and vitamin C. It's so interesting. And my parents are 93, both of them, and in pretty good health and pretty cognitively aware. But my mom, who was a nurse, has taken vitamin C for as long as I can remember, and like swears by vitamin C. So I'm gonna say you have it in here. So I'm like, there must be some truth to my dear old mom.
I know the old school zinc and vitamin
Yeah.
C. I mean, there is definitely truth. I mean, you go on PubMed, there are thousands and thousands of peer-reviewed research on vitamin C. So there is so much information out there supporting vitamin C. I personally, as far as absorption purposes, I like the liposomal form. I think it works really well. Zinc also it's antiviral. I mean, that's another thing. Everyone's popping zinc. Well, there's a reason to it, which probably most people don't understand, but it actually helps inhibit what's called RNA-dependent RNA polymerases, which is involved in the viral life cycle. So that is where they work. So a lot of these supplements that I recommend and that, we're taking at home and I prescribe for my patients, especially this time of year, they're really working on that whole viral life cycle.
And we're not, again, when we're talking viral life cycle, we're not talking the COVID-19 that we have today. Like, no one's going to pop some vitamin C and zinc. I don't want people to think they're going to pop vitamin C and zinc and that's going to, they're going to be they're not going to get the virus. But what you're saying is you can protect your insides. You can strengthen your insides from vitamin C, vitamin D, zinc.
Right, and enhance your immunity ultimately. And then if you do get sick, you're decreasing your downtime once again and allowing you're increasing your immunity by allowing your immune system to work the way it should work.
Instead of working harder.
Yeah.
Which,
yeah.
Right. Right. And when you said about vitamin C, you said there was, what kind did you say you think is more absorbable?
Personally, like the liposomal form. That's just the one.
What's that?
It comes along like attached to a fat or with the fat in the supplement, I should say. So that helps with the absorption of it, actually.
Oh, interesting. Okay. And equally as taking supplements, I'm going back to how we initially started this conversation with you. The real benefit of vitamin D and vitamin C and zinc and everything should come from food, right? I mean, right?
Yes, like eating like clean. I love plant-based diets. Mediterranean diet, I love the Mediterranean diet. I'm very much in favor of it. Again, it's backed by a lot of studies.
Yeah.
And Mediterranean diet actually helps prevent those chronic diseases like diabetes and hypertension, which are some of the illnesses that are causing these complications for those who do become infected with COVID. So the Mediterranean diet is very beneficial to follow, I think.
It would be, I know it could never be done, but it would be an interesting study to see how many people got COVID on the Mediterranean diet versus how many people were living just a regular regular diet. But I mean, there's no way to really get accurate numbers on that, but it gets you thinking, like, because I know there were the blue zone studies for people who had from Harvard, for longevity. And it talked a lot about, community and family connection is all really important for long lifestyle. But I also know that the Mediterranean diet also promotes a longer lifespan.
Yes.
So it's like, it's all connected, right? One of the other items you have in here and myself being asthmatic, glutathione.
Glutathione, yes.
Glutathione, okay. So because with COVID-19, obviously, and I'm not saying this is going to prevent anything, but it's one of the impacts is the lungs, right? And so for a lot of people, and so I was interested in this because it says here, people who suffer from pulmonary disease, cardiovascular, whatever, tend to have low levels of that. And so is that tested? Can you test that? Obviously through blood work then, I guess, when I was with you, right?
Glutathione can be tested, and people tend to be low in it. Actually, as we age, glutathione is one of our body's natural antioxidants. So that actually becomes depleted as we age. So it's one of those antioxidants that it's really important to be on top of. And a lot of times, in order to properly keep our glutathione levels to the level where they should be, optimal levels. Taking glutathione and supplementation alone is not really the cure-all. I mean, you have to take also their precursors like NAC, which people also refer to as NAC, and alpha lipoic acid. NAC, NAC, I do want to mention, not a lot of people know about NAC.
No, I've never even heard of it.
Oh, so NAC stands for N-acetylcysteine.
Yeah.
It's also another one of my favorite supplements that I prescribe. It's a precursor to glutathione. It's actually one of these few supplements that can cross the blood-brain barrier. So as far as anti-aging goes, as far as dementia and whatnot, NAC and glutathione can have been shown to be helpful for that. The other thing NAC does, it blocks what's called NF-kappa B, which is involved in the whole inflammatory cytokine synthesis. So that's another way in which it works. And then also NAC, when I have found, and there are some studies out there, that it actually helps decrease, it helps with the proteins that are produced in the mucus to help thin them. So if you get like any, congestion of any kind, if you take that, it helps thin out that mucus so you can get rid of it better.
Oh, that's really interesting.
Yeah.
So that sounds pretty powerful. So the NAC, which I'm not even going to try to, is that a supplement as well? Right.
Yes.
That's a supplement as well. And people shouldn't just be popping supplements, right? You should do it under, right? So I don't want anybody, right, to come on and say, oh, I heard all these supplements. Let me just, you have to do it under a care of your physician.
Right. I definitely recommend that, because some of these, although supplements are helpful and very, very beneficial, there is a place for this alternative medicine as well as conventional medicine. But no, just like conventional medicine can have its effects, so can alternative medicine. Quercetin, for example, can have some estrogenic effects. So that we're going to have to be careful with certain patients that have issues with certain types of cancer that are driven by estrogen. So that's not something I would recommend.
Right.
And then as well as, certain other conditions you just have to be careful of. Some herbs and supplements too can have blood thinning effects, so that you want to be careful with that. And yeah, so I definitely recommend seeing somebody just for some guidance, just to get a jump start on everything is very important.
Yeah, because I'm like, wow, I'm like, well, I would take all of these. And then I'm like, well, no, that's probably not a good idea, without having working with somebody, so you could have a baseline and see what your body needs, because obviously every body is very different, right? So the other thing going over, so obviously we hear diet, exercise, sleep, those are the main ingredients in keeping a healthy life. And what I have found in COVID is I think every one of those things has been disrupted, right? Our sleep cycles are disrupted. We're not, people aren't traditionally at the office like they need to be. They don't have to be on a call at a certain time. They can sleep in later, or like you're staying up later. And I know that in here, and we talked about it earlier, like just regular exercise, the gyms have been closed, or even though they're open, people aren't comfortable going back. So as much as the supplements are good to take, I would imagine they're only as good as kind of the rest of what we do, right?
Yeah, it's a whole package. I mean, everything from diet to supplements, lifestyle is huge. You can take all these vitamins, but if you're not addressing your stress and your lifestyle, what good are they going to be? So it's really important that's ultimately, I think, step one for everybody when they're trying to make sure their immune system is strong and they're getting on the right track with their health overall, is their diet, their lifestyle, getting good quality sleep, working on their stress. That's really important, because stress is what ultimately will have an effect on our immune system. It doesn't matter what we take. If we're not managing our stress well, and our anxiety and depression, anything else that's going on in our lives,
right,
we're just going to go down more. That's just how it works. So,
right. So no supplement is going to take care of managing our stress. And
no.
So supplements really only work as well as we manage other areas, right, of our life.
Yes, exactly. And it is challenging now, especially, well, gyms are closed and not fully open, or for some gyms that are open, they're not, working like they used to. It's been definitely challenging for people who are social, who like to go out and work out. So, me being one of those people, it's just a matter of finding another way and just creating a new routine and finding other ways to address our mental health. It's important to do that. And just, people struggle with that, but there are options, there are answers. It's just a matter of finding what fits for each individual.
Right. And that's where I think your work comes in and kind of creating that whole person plan. So it's not just giving somebody the, supplements. It's also, let's look at your whole lifestyle and let's work on all components of it so that it all works in unison. Right.
Right, exactly. And that's actually when I see my patients, it's one of our treatments is that when I go over a list of things that they're going to take, then finally I'm like, well, now what are you going to do about your stress? What are you going to do to make time for yourself? So this way you're going to start feeling better emotionally.
Mm-hmm.
That is actually probably the number one course of my treatment. Forget about supplements. It's that.
It's about how are they going to help take care of themselves regardless of a supplement. What are you doing for yourself?
Yes.
And that might mean end up in therapy, or it might mean more exercise, or it might mean couples therapy, or something along those lines, or right.
Right. I'll help my patients because, like I said, like sometimes people, they struggle with trying to find themselves and to come up with new routines. So I'll help them come up with a game plan, for the week or whatnot, whatever it is they need. And if that doesn't work, then we go back to square one and we come up with more ideas together, and we eventually are able to figure it out. So they're happier.
Yeah, I it's kind of like a coaching program mixed in with the naturopathic part of it, right? And the last thing here that you touched on was about obviously taking care of anxiety and depression, but the alcohol. So in your article, it says new studies are claiming that over 70,000 people will die from drugs, alcohol, and suicide during the pandemic. But what I've seen is that alcohol consumption has not only has it risen, but it's risen in a huge way for women. And so are you seeing any of that in your own practice or come across it at all?
I'm coming across it a lot. It's tough for a lot of, not all women, but some women, especially for, I have friends who are at home and they have little ones and they're working on school through Zoom, which is really challenging for the young ones,
Yes.
very challenging. So, moms have to be fully on deck as mom and teacher, and it's stressful. And so a lot of them are turning to a glass of wine here and there to help them relax. But over time, having a glass here and there just keeps adding up, and then eventually affects their sleep, and then affects their hormones. So long term, it's not going to have any benefits. Although initially it may be calming to them, there are definitely better ways to try to find ways to calm down without having an ill effect on our health.
Yeah, I think sometimes you don't even notice you're doing it. I think people don't even realize that it used to be one glass of wine during the week, that now it's two, or now it's every day, after dinner or whatever, where it wasn't that before, but it's subtle.
Yeah. Yeah.
It's subtle. And so if women or someone or a man was watching this, laying in bed at night, and they wanted just a couple of nuggets of wisdom from you about how to prep for going into the fall season, fall and winter here, what are some things you might encourage people to do?
Well, step one is working on their mental health. That's a big one. So find, if you don't have an activity that you enjoy doing now, working your best to try to find it. I mean, it doesn't have to be running 3 miles. I mean, it could be something simple as, finding new books to read. I was fortunate enough to find a nice group of friends, and we have a nice Zoom book reading every week or every other week, and we sit together and we talk about it. So that's been really helpful for me personally.
Right.
Um, Other things, sleep, make sure you still get on that sleep routine and don't lose it. Eventually, sleep is actually so important. If you lose sleep over time, it actually affects your sympathetic nervous system, and it affects your ability to respond to stress, and eventually can cause pain, inflammation, affect your hormones. It has so many effects if you don't get good quality sleep. So
Are
that's
there natural, other than the melatonin thing, are there natural ways for somebody to help get more quality sleep?
yeah. So there's some actually funny. Melatonin is not my go-to for sleep. I will say that it's not my first weapon. I definitely have other things I prefer. One is no screens in the room, no phone even next to you, even if it's off, like there's still in the back of your mind, it's sitting there. So I don't allow screens in the room, especially in my house. It's not allowed, which my children are not a fan of, but they'll appreciate it one day.
I'll love you when they're older.
Right? So the no screens, try to work on, more calming activities before bed. Nice hot bath is great with, Epsom salts is wonderful. Reading actual paper book, not on the screen again.
Yep.
Meditations are phenomenal. Although meditations are not pharmaceutical, they have a lot of benefits where they have been shown to help with anti-aging, helping decrease inflammation and chronic illnesses. So I definitely recommend trying that. Some people it's hard to turn off, but over time that, just listening to something calming for 5 minutes and then turning that into 10, and then you'll get into a new habit and a good habit, a routine of helping calm your brain down. That's very important. Other things for sleep, I like L-theanine. There are a lot of great teas out there. I'm a big tea lover for many reasons. One is big reason, especially for a lot of my patients, I prescribe teas a lot. And the reason being is you can actually change the dose in a tea very easily rather than a pill or any other way. And so there are different teas: chamomile, valerian, passion flower. Those are some of my my favorite teas. So with the teas, you can actually increase the dose with the tea bag. So you start off with 1 bag in a cup, and if you're not feeling that much, then you up it to 2. And sometimes I tell my patients you can go up to like 4 tea bags in a cup to get the therapeutic dose. Yeah.
Oh, I've never heard that before.
Yeah. So
that's smart.
Yeah, it's really, it is. And it avoids taking more pills. So that's the other thing with the supplements. They can become so overwhelming. So there are other ways to get some other health benefits from the teas, from our nutrition, without having to constantly swallow so many pills.
Right.
Another favorite tea of mine that I do want to share, because not a lot of people know about this either, is holy basil or tulsi tea. I love that tea. A lot of my female patients love it too, especially those who are going through menopause and who experience that daytime stress or fatigue. I have them just drink tulsi tea during the day, and it's very calming and relaxing and balancing.
How do you spell that for people listening?
Tulsi, also known as holy basil. Yeah.
Basil. I never heard of that. Are you saying that, does that give people a extra sleep benefit? Is that the goal of that tea, or is it more of a calming agent?
More balancing, actually.
Okay.
Yes.
Gotcha. I never heard of that. I love that though, because I think there needs to be other things than melatonin, because I have a lot of people who say, I take it, but it doesn't work. So I just increase that. And I'm like, I don't think that's a very good idea. Like, if it's not working, then look for something else. Don't increase the dose.
Right, exactly. And I have some patients, some of my Lyme patients in particular too, who are very sensitive to melatonin, and they don't do well with it when they take it. So there are other options, maybe even better options that are more gentle than melatonin, because melatonin at the end of the day, it is a hormone too.
As long as we're on melatonin for a minute, I have friends who give their kids like the melatonin to go to sleep for them. Is that, I don't want to say harmful. Is that a good idea?
Well, it's not my first go-to.
That's your first go-to. You'd rather have a child per se, and maybe could a child like have a cup of tea? Right? Like, is that?
Well, with children too, I treat a lot of kids actually. It's a good bulk of my practice. And with the kid, and plus I have my own kids, so I go through it. I live it. So I know when people come to me what they're talking about. So for kids, I've never ever gave my kids melatonin. I have done more gentle things. There are different things like rescue remedy. There's Bach flower essences to help with sleep. Again, the teas, there's, sleepy time tea, which is nice for the kids.
Okay.
Then again, it also, okay, well, why are they not sleeping? So that's the other thing with, prescribing treatments. It's, you have to find out the why. If somebody is not sleeping, whether it's a child or an adult, why are you not sleeping? What's going on? Is it another stress? Is it an illness? Is it some neurotransmitter imbalance? So it's really important to find out the why and treat the why accordingly, and more, that'll be more effective. Instead of popping pills and just throwing darts in the air, you're not going to find out, you're not going to solve your problem just by taking pills. You need to find out why to get better.
Well, but isn't that the difference between how we've been treated medically in our country? Like we don't really go to the why per se. You just treat whatever the issue is. And I think more naturopathic or functional medicine treats more of the why.
Yes.
Get to the root of it.
Right. And that's important because like I said, you can take anything and do this and do that. But if you don't know why you're experiencing symptoms or an illness, you're not going to get better. So that's very important to do. It's the heart of regaining our health is treating the why.
Yeah, because once you know why, then you know what action to take as opposed to what pill to take.
Yes, exactly. It's more precise and it's more individualized because everybody's so different. Mm-hmm. Not everybody should, if somebody's not sleeping well, melatonin is not the answer for everybody. Right. Everybody has their own concerns and issues going on.
All right. So let's do the last one, which is, I'm sure you're going to speak to like exercises being significant to making kind of all that well-rounded picture.
Yes. I'm huge into fitness. I exercise every day. So I feel like exercise is very important. It actually helps us sleep better. Exercise also, there are studies out there too that show its benefits where it actually helps increase our immune function. And what it does is one study showed after like 40 to 60 minutes of vigorous exercise, our immune system amps up where it actually, our immune surveillance was increased. So all our immune cells were deployed to our peripheral tissues to help fight off any infections. So exercise is really important for our mental health, our physical health, and our immune health.
And when you go back to what you've been talking about all along is kind of like really looking at what you can do with that stress. That's also one way exercise benefits our stress levels, right?
Yes. Yeah, because you're also secreting your natural feel-good endorphins when you're exercising. So that helps on so many levels. It is actually one of our best antidepressants ever. So it's our antidepressant not being in pill form. So
I think a lot of people think, well, I don't run and I'm not going to run a marathon and I'm not running like that's not what that's about. Like during COVID, like I started biking and playing pickleball. Right. And it's like just to get out and move my body. The gyms were closed, and I'm not talking biking up major mountains or stuff, but it's like I just tell people just do something.
Right, exactly. I mean, there's so many activities. I mean, pickleball, who's going to think of pickleball? But it's out there. There's so many things.
I love it. Love it.
Yes, so that's great. I love pickleball.
Yeah, it's fun. You move your body in a different way. And I consider that working like a workout because I'm chasing a ball around, and I think it's just a lot of fun. It's a good way to meet people and be social.
Yes, it's a healthy way to be social at a distance too.
Yeah, instead of wine, I'm like, because I could find more people to go have a glass of wine with me than I can to go do a sport. Like it's hard. It's hard. I don't know. It's, do you want to have a drink? No. Do you want to take a bike ride? Oh, no. Yeah. But we need a little of both, right? I mean, we need a little of both. Well, Well, so it really is, get the right supplements. And I know I'm not asking you to name brands or anything, but working with somebody such as yourself, you could align people with supplements that would be good for them, right?
Yes.
Okay. Because I just want to be clear, because you can just go over the counter and get whatever and spend a boatload of money that you may not be getting the best bang for your buck or the quality that you could have.
Right, exactly. And supplements can be very expensive, especially if you're taking them on a regular basis. It's an added expense. So if you're going to spend the money, make sure you get good quality supplements.
Right. I think that's key. Well, thank you so much for coming on. I really really appreciate your time. I could spend a lot of time talking about health because it's just so important, especially right now, with how to strengthen our resiliency through through the upcoming winter season. But it goes back to what you were saying. This should be in general. It should be not something we're like padding, but it should be part of our lifestyle.
Yes. Yeah, I
So
agree.
good information. Thank you so much for coming on. I'm going to post your contact information, and people can reach out to you by email. Is that okay?
Email, or they can call my office. Whatever's easier for them. And
All right. I'll have that, Dr. Veena's information and the details below. Thank you so much for coming on. I appreciate your time.
thank you, Colleen.
And we'll touch base again.
Yes, thank
All
you.
right. Thank you. Have a great day.
You too.